I'm going to talk about health insurance 101, so stay tuned. I'm Keith Armbrecht, founder of Exit Obamacare. I hope you find the information in this video very helpful and presented in an easy to understand format. Finding the right health insurance plan can be very complicated. Fortunately, we now have a better option. So effective January 1st, 2019, there's no longer a mandate that you must purchase your health insurance through the Obamacare marketplace. So that also means no more penalties. So now we can get real insurance at a much more affordable price, utilizing a true PPO network that gives us access to more doctors and more hospitals throughout the country. So after this video, take just a few moments to explore exitobamacare.com and I'll show you exactly how it's done. Okay, I'm going to do a little bit of health insurance 101. So I'm going to just go over the basics of health insurance and show you kind of what you need to understand and what to look for if you're purchasing health insurance. And, you know, it's kind of crazy that we go through life with stuff like health insurance. And, you know, if you're working for a large employer and you get it at work, you know, every year they give you a packet and say, pick your health insurance. And you're supposed to know what to pick. Or if you're doing it on your own, which is even worse, you got to go out and find your health insurance, and then you got to decide which plan is the best plan for the best price with the best coverage. It's kind of silly. So I'm going to just give a quick overview on how to understand it, and then hopefully that's going to help you when you need to make a decision. Now, the main reason I'm doing these videos now is, if you don't know, effective January 1st, 2019, we no longer have to participate in the Obamacare marketplace. So things have changed, and it's a pretty major change that there now will no longer be a mandate or a penalty if you are not in the marketplace. And now we have the absolute ability to get much better insurance at a much lower cost. So we need to understand it, and then that way you can make the best decision. So now we have freedom of choice, which is certainly a wonderful thing. So let's talk about the things we need to understand about health insurance. Number one, the deductible. Number two, co-insurance, copay, maximum out-of-pocket, and lifetime maximum. So these are the main terms that you need to understand when you're looking at a health insurance plan so that you get what's going to be good for you. So let's go one by one. So deductible. The deductible is what you pay before the insurance company contributes a dime. Now, what a lot of folks don't really quite understand is even if you had a high deductible, because you have that insurance, you're already getting a major discount. So insurance companies pre-negotiate rates with doctors and hospitals. So if you're in a PPO network, what that means is those doctors have already signed a contract with the insurance company to charge X amount for X procedure. So for instance, if you went into the hospital for a broken arm, you know, if you didn't have insurance, it might be $6,000 to take care of your broken arm. Just because you have insurance, it may bring it down to $2,000. Now that has nothing to do with your deductible, your co-insurance. That just gives you a much better starting point. And so that's a big, big deal. So even if you had insurance with a high deductible, you know, that can still work in your advantage because you get the pre-negotiated discounted rates on everything from an office visit to a major surgery. So super important to have insurance no matter, you know, which one you have right off the bat. But still, we want to make it as good as we can. So deductible, understanding, that's what you're going to pay out of pocket before the insurance company then starts to pay as well. So you're going to have the discounted rates, but you're going to pay your deductible first, and then it's going to kick in on the insurance carrier side. And then once you've met your deductible, that's when the co-insurance will come in. Usually it's either 80-20 or 70-30, sometimes 60-40, which wouldn't be so good. But let's talk about 80-20. So when you have co-insurance, it's 80-20. That means the insurance company is going to pay 80% and you're going to be responsible for 20%. So here we would have first your deductible. So let's say you have a $2,500 deductible. So when you go to the doctor or when you go to the hospital, you're going to have the discounted rates. And so you're already going to get a discount on the rates because you have the insurance carrier contracts. So, but you're going to pay the first $2,500 out of pocket. And then once you hit your $2,500 deductible, so we're talking about a $2,500 deductible, then it's going to go to 80/20. So after you've reached your deductible, the insurance company is then going to pay 80% of that discounted rate, and you're going to be responsible for 20% of the discounted rate. So if you had a $1,000 bill in the hospital after your deductible, insurance company is going to pay $80 or $800 of that bill, and you're going to pay $200 of that bill. Then you also have a copay. So some plans have copays. Now copays generally go before your deductible. So let's say you had a $2,500 deductible plan, but you have a $20 copay office visit. Most plans set up with copays, when you go to the office visit, it's not going to come through your deductible. You're simply going to pay your $20 copay, and that's going to be the end of it. So if you have a copay plan, and they can be more expensive, obviously, because it's paying right off the bat. So when you figure out premium versus benefit, obviously the higher the deductible, the lower the premium. The lower the deductible, the higher the premium. And then if you have a copay plan, it takes care of certain things without the deductible, like an office visit for going to regular doctor's visits. Now, the last term that we need to understand is lifetime maximum. So lifetime maximum is what a plan is going to pay for the life of the plan. So as long as you have it. So you want to look at that lifetime maximum, make sure it's certainly at least $1 million, and then not bad if it's more than $1 million. In the old days, they used to be unlimited, but pretty rare to find unlimited anymore, and also pretty rare to exceed $1 million in a lifetime benefit, but it does happen on very rare occasions. But $1 million is a pretty good starting point, and just kind of keeps you comfortable that you have enough coverage. So that gives you kind of an overview on Insurance 101, and I hope you found this helpful. And remember, things are changing on January 1st, 2019, so make sure to look at Exit Obamacare, run a quote for what it would cost for your insurance. I walk you right through it. I make it very easy for you to figure it all out. And then if you have any questions with it, you can come back to any of my videos, and I try to lay everything out without having a whole bunch of people call you. So try to make it as easy as we can. So I hope you found that helpful, and I hope you have a great day.